Thank you so much for joining me here at the live desk. I am Janae Hancock, and welcome to Friday. It is October the 13th, and we have so many stories that we are tracking here inside of the KCTV5 newsroom to start your weekend. But I do want to start off with this subject, the story that we will be talking about here on the live desk today. Take a look at this video you see here on your screen. There are currently 260 people in Missouri jails waiting to be transferred to a hospital for mental health treatment. Now, this as state officials work to develop plans for a program approved by the legislature this year. Those 260 people were arrested, deemed unfit to stand trial, and ordered into mental health treatment. But they are supposed to receive mental health services that allow them to stand trial. With all of that being said, I do want to turn things over to our guests for today. You are taking a look at Dr. Jeanette Simmons. She is the Deputy Director of the Division of Behavioral Health at the Department of Mental Health. And Dr. Simmons, I want to thank you so much for joining me here at the live desk. How's it going today?
Great. How are you?
I am doing well. You know, I want to jump straight into this topic and get straight to the questions that I'm sure a lot of people have. What is the main holdup? Why is this happening?
So we have always had individuals that we were trying to get in to our facilities for competency restoration. And frankly, over the last several years, the number of individuals referred has just exploded. So it is a supply and demand issue at this point. We have more people referred to us than we have inpatient capacity. And we did have some shutdowns during the course of COVID. We had to close. We had staffing issues that we had to make some decisions about. But those have resolved and we have opened all those units up. So at this point, it's just a matter of trying to get everyone who's been referred in.
Right. So the staffing issues, it's no longer a thing right now. Is that correct?
Correct. We still struggle with staffing and it's an ongoing thing, but that is not the reason for not being able to get folks in at this point.
And so we did touch on the fact that, last month, I want to focus on this number that is coming in as well. There were 253 people waiting treatment, and the wait time was set at least 8 months. Do we know the current wait time as of right now, today, October 13th?
So the average remains about that much, about 8 months to get in. Now, we do expedite individuals based on clinical need. And so some people do come in sooner than that if they are experiencing a crisis such that they need a bed sooner than that.
And this has to be frustrating for not only the people who were sitting inside of the jails waiting for treatment, but also their families who know that they are waiting at least 8 months to get treatment.
It is, and we have developed some forensic mobile teams across the state that go into jails and provide treatment, particularly psychiatric medication, but also other types of clinical interventions to those individuals while they're waiting, because we certainly don't want them to have to wait to come to a bed to start treatment.
Okay, and going back to that number, 260 people currently inside of those Missouri jails, do we know how many people will be added to that list?
So at this point, we have 47 individuals that our examiners have opined are incompetent to proceed, and we anticipate receiving a court order with that designation.
And so what happens next? Tell us a little bit more about the program that's currently in the works.
So the legislature did pass changes to our statute, which will allow for outpatient restoration for those individuals who can be successful on bond, and also passed provisions for jail-based restoration in 5 county jails. And so we are working with those counties and our community providers to get that up and running. So that should make a difference for those individuals who are waiting. Some of them will be able to be served on an outpatient basis in the community, and others can be served right there in their jail.
And so there's hope there. And as far as what's included inside of the program, we're talking room and board as well as medical care. Is that correct?
Correct.
Awesome. Okay, Dr. Simmons, is there anything else that you would like to add into this interview that I have not asked you?
No, thank you very much.
Awesome. Thank you so much. Again, taking a look at that file video we have here at the live desk. This year's budget set aside $2.5 million for the programs to be established in jails. We're talking in St. Louis County, Jackson County, Clay County, and Greene County. We will have so much more coming up during our evening newscasts.